One of the factors that can cause heat-related illnesses is exposure to heat. No, hindi porket bata ka, you can already cope easily.
Listen to your body, be mindful. There are a lot of defense mechanisms of our body. Take a drink, hydrate, stay off the sun.
Since the start of the summer season, the Weather Bureau reported that 2 areas in the country have already logged the highest heat index so far. When our bodies are exposed to such high temperatures for long periods of time, we're vulnerable to a number of heat-related illnesses. As we brace for the hot weather, we need to take every precaution to protect ourselves from the summer sun. I'm Dr. Freddy Gomez, and welcome to Med Talk Health Talk. The Department of Health reminds us to take extra care, especially in this season with heat-related illnesses. So with me is interventional cardiologist Dr. Rodney Jimenez, who's also the Secretary of the Philippine Heart Association and a board member of the Philippine College of Physicians. Hello and welcome, Dr. Rodney. Let's explain to our viewers how the body is actually a very marvelous system in that it can actually cool itself down. So explain some of the ways that our body tries to cool itself on its own.
Our body has a lot of ways to maintain our core body temperature. This is to avoid exposure of heat to our body, to avoid dysfunction of our organ system. One is sweating. Our brain tells the sweat glands to sweat, to evaporate, and this evaporation cools down our body and the skin. Second is vasodilation, or the blood vessel will dilate or increase in diameter. This will dissipate the heat in our body. And also, behavioral adaptation like thirst. So, it will tell our body to drink a lot of water to hydrate.
Now, Dr. Rodney, where does it go wrong? At what point na hindi na kaya ng katawan to cool itself on its own?
Well, our body has limits. If you are exposed to a very hot environment or temperature, it can dysregulate or it can be a pathologic to our body. So it will shut down our kidneys, it will shut down our brain because it will shrink our brain cells and then cause confusion. Our body will increase in heart rate and excessive sweat, dehydration, and then decrease the blood pressure.
You mentioned about the environment being extra hot. Is there a certain time that is safe to be exposed outdoor in the sun?
We all know that the hottest time of the day will be between 10 a.m. to 4 p.m. So you have to avoid exposing yourself to those time or the range of that time.
Are there certain people who are more prone to feeling the effects itong hindi na maka-thermoregulate ang ating katawan?
So there are a vulnerable group of people. One is elderly people, second are very young people, and then those patients with chronic illnesses like heart failure, coronary artery disease, COPD, and also people who are exposed or working hot.
Ibig sabihin ba nun na, Doc Rodney, hindi pare-pareho ang limits ng mga tao when it comes to
hindi
heat?
pare-pareho. When you have a child with you, yung isang bata na yan, cannot easily regulate. Maliit lang yung body surface area niya. And of course, if you're also with an elderly, baka kala mo pareho kayo ng coping mechanism on very hot environment. No? So hindi. Very different. No? So also, long exposure, athletes or athletic people, very different. It depends on the exposure and also your condition of the body.
Now let's talk about heat stroke. Let's talk about some of the symptoms that is commonly exhibited or what our body tells us kapag meron na tayong heat exhaustion.
So let's differentiate yung heat exhaustion sa heat stroke. Heat exhaustion, yung milder version siya ng heat stroke. Yung heat exhaustion, you feel tired, no? Exhausted and dehydrated, excessive sweating. And then heat stroke naman is number one criterion would be body temperature of more than 40 degrees Celsius. And there's also confusion, sometimes seizures.
But speaking of things that can aggravate the situation, when someone is experiencing heat exhaustion, like what you said, can certain drinks or food aggravate the situation?
Especially alcohol. Alcohol is also bad to our body, and it can also cause excessive diuresis or excessive urinating, no? So it causes dryness and increase in heart rate. But theoretically, also caffeine, if you're already exposed to very hot environment, it can aggravate also tachycardia or increase in heart rate, and it causes diuresis and excessive urinating. So you will be more dehydrated, no?
Okay.
So better water.
So napaka-important points po yon. And you should also know the symptoms, what you feel, what your body tells you when you're undergoing heat exhaustion, because this could lead to heat stroke, which is one of the more serious illnesses, which we will be talking about after the break. So stay with us here on Med Talk, Health Talk. In a tropical country such as ours, we are exposed to a number of heat-related illnesses. One of the most serious ones is heat stroke. Now, to help us understand what exactly is heat stroke, please welcome back Dr. Rodney Jimenez, interventional cardiologist, secretary of the Philippine Heart Association, and a board member of the Philippine College of Physicians. Doc Rodney, let's talk about heat stroke. Kaagad-agad ba ito nangyayari? Pag sinabing heat stroke, Doc Rodney, is this similar sa brain attack?
No, hindi siya kagad-agad nangyayari. It happens slowly. Dapat ma-recognize natin some of the symptoms to avoid heat stroke. And how does it differentiate to the stroke or the brain stroke and even the heart attack? No? So heat stroke is related to excessive heat in the environment. Core temperature is very high, no? More than 40 degrees. Stroke naman of the brain, there's a blockage of the blood vessel natin sa brain that can decrease perfusion to our brain or also bleed, no? Yun yung stroke. And yung stroke naman sa heart na sinasabi natin sa the heart attack, blockage din siya of the arteries of our heart. Very different, no? Tinawag lang na heat. Kaya may heat stroke, dapat may kaakibay na heat dun sa stroke para i-differentiate natin siya sa brain stroke and heart.
What exactly happens sa ating katawan sa heat stroke, Doc Rodney? How is it such a serious situation?
Body natin has a coping mechanism to heat, no? But the body has its own limits. So hindi niya ma-accommodate yung or ma-cope kagad yung very excessive heat in the environment. So excessive sweating can cause dehydration. No? So if you are dehydrated, decrease yung blood pressure. Decreasing in blood pressure will also cause hypoperfusion in our brain, o yung wala na tayong blood perfusion sa brain, wala na tayong blood perfusion sa heart, decreasing blood and perfusion rin sa kidneys natin, and that will cause shutdown and cause heart failure. And sometimes, in worse condition, it can shrink our blood cells in our body, no? So that will shut down our system.
Now, kapag umabot tayo sa heat stroke, is this a reversible situation?
Yes, it is. Dapat ma-recognize natin agad the symptoms, no? So hindi dapat tayo makaabot dun sa conditions that we don't want to see.
When you mention confusion, what's a good sign na confused ang isang tao, which could be a sign of heat stroke?
Hindi na siya oriented to place, to person, to time, no? So, pag tinatanong mo siya yung name niya, baka hindi niya na malaman or hindi niya alam kung nasan siya.
Those are very serious conditions indeed, something that will benefit our viewers, lalong-lalo na pag na-spot nila ito. What is the general principle when someone is experiencing these symptoms? Anong yung immediate goal natin?
Our body has its own behavior adaptation, no? So we seek sa cooler places. Punta na tayo sa may shade or air-conditioned area, and then we remove our clothing kung thick siya, and then we drink a lot of water. Kung merong ice, no? Maglagay natin ng ice yung patient o yung person na yon who is experiencing heat stroke.
Now, of course, when it comes to heat stroke, one of the organs that is overworked in this situation is yung ating heart, is ating puso. Is it very evident, Doc Rodney, that a person who has a problem with their heart can actually feel that there is something there?
Number one cause of heart disease is the coronary artery disease or yung blockage of the coronary arteries. One symptom is yung chest pain, saka yung palpitations, or chest heaviness, or easy fatigability and shortness of breath. If you have this and then you experience a lot of heat also, your body cannot easily cope immediately to heat stroke. So dapat we have to also have ourselves checked with our doctors regarding our heart problem. And regarding heart problem, so we have this Philippine Heart Association advocacy, the 50 to 100 to keep your heart healthy and to prevent heart diseases. So 5 servings of fruits and vegetables every day, less than 2 grams of sodium, no? So bawasan natin ng salt, and 1 hour of exercise if you can, or 10,000 steps a day, no? So 0 smoking and 0 sugary beverages, no? So avoid natin yung sugar. So that will help prevent heart diseases in the future.
Now, we really learned a lot of things from you today, Doc Rodney. But before I let you go, do you have any advice, any tips for our viewers?
Regarding heat stroke or heat related illnesses, so we have to be aware of the environment. So let's check the temperature outside, no? Let's avoid exposure to heat. Let's avoid the time between 10 a.m. to 4 p.m. Keep ourselves hydrated. So baon tayo lagi ng water.
Very good advice. Thank you so much again, interventional cardiologist Dr. Rodney Jimenez. So heat stroke is a very serious condition and you have to know the signs and symptoms in order to do something about it when it occurs. But when it does occur, what should you do? What is the first aid? That's what we'll be talking about when MedTalk Health Talk returns. Going to 40 degrees or even more, all of us are vulnerable to heat-related situations. And knowing basic first aid is key in protecting not just ourselves, but those around us. Now, here to tell us more about this with me today is emergency medicine specialist Dr. Pauline Convocar, who's the head of the emergency department here at the Manila Doctors Hospital and is also the president of the Asian Society of Emergency Medicine. Hello and welcome, Dr. Pauline. Earlier on the program, we talked about how to spot the symptoms of someone who is undergoing heat exhaustion and even the more serious situation of heat stroke. Now let's talk about basic first aid. So basic first aid for those with no medical background, because as much as possible, what we don't want is to put someone in a worse situation than they actually are, but some basic first aid tips so that they can do something. So let's start first with how to spot heat stroke and ano bang dapat nilang gawin agad-agad, Doktora?
So with basic first aid, we really have this dictum that first do no harm, of course. And then if there is a situation when a responder puts his or her life at risk, then at no way will they proceed. So the very things that need to be recognized with the health-related illnesses, because it is a spectrum, is to immediately recognize if there is a heat-related emergency. So because it is a spectrum, there's a lot of situations from heat exhaustion to the extreme, which is heat stroke, which really needs the patient to be brought to an emergency department.
The basic principle of someone who is undergoing or in that situation of heat stroke is pabababain dapat ang core temperature nila as quick as possible. What are some ways? What are some safe ways that our viewers can take with them kapag, nasa trip sila, vacation sila? How can they lower someone's body temperature quickly?
There are 3 classic theories of what the situations are putting them at risk. So one is that of a classic thing that there's just a very hot environment and we need to take the patient out from that situation. The second is that exertional. So these are situations when athletes are really exerting too much or in a very hot environment. And then the third thing is a confined space. So for example, if we have workers who are working in extremes of environments, all of these given situations, the very first thing that should be done is take them out of that situation.
What are some key factors to bring along with them just in case they undergo some heat-related illness?
The tips here are very practical. Listen to your body. The body has this defense mechanism to know when you're already dehydrated, you're thirsty. You'll also somehow feel a bit faint. But on the extreme side, people really faint because of heat exhaustion or heat stroke. So what to do is that you should wear light clothing. Even the color has impact actually with heat absorption. And then also it's very important to bring fluids or water. But of course we know that sweat does not just mean it's water that we are losing. Sunblocks and a shade or a hat may be helpful if you're going to outdoors for your any activity.
What should people not do, absolutely not do, whenever someone is in a serious situation, especially heat stroke? Because we see it a lot, sinasampa lang ang mukha, binubuhusan ng tubig sa mukha. What are some things that should not be done, which are sort of myths?
On the part of the responder, there's always situational awareness that one does not put him or herself in a difficult situation where it endangers his or herself. And then we do not actually buhos ng tubig because it may aggravate the situation. And there is such a thing also as too much aggressive lowering of the temperature, which makes the body shiver, which increases the core temperature all the more. So we only control the lowering of the temperature in a safe manner, and there are a lot of practical tips to lower the temperature and not that aggressive buhos ng tubig.
Is it okay to try and perform CPR or cardiopulmonary resuscitation if you don't have the training? Napanood lang sa TV, more or less kung paano gawin ito, susubukan sa isang tao?
Yeah, that's a very controversial question. But if ever there is a choice to perform CPR, if it's indicated, it's okay as long as there's basic training for it. Because no CPR is actually worse than doing CPR the wrong way. But of course, it's always okay to immediately call for help and have training because there are really trainings for lay even.
Can people get educated on how to do CPR kahit walang medical background?
Yes, definitely. Everyone can save a life. So it is not only for the doctors or even for the healthcare professionals. Any lay can save a life.
Those are very good advice, Doktora. But before we go, any advice, any tips for our viewers, lalong-lalo na ngayon na tag-init na?
For the general public, I think it's very important that we schedule our activities and listen to our body. So the body knows when to be thirsty and when to drink and hydrate. Also, for the responders, it's very okay to have more advanced training so that everyone can save lives.
Thank you so much for your time and expertise, Emergency Medicine Specialist, Dr. Pauline Convocar. Some important tips: drink a lot of water and constantly check the heat index so you can plan your activities accordingly and monitor how you're feeling throughout your time under the sun. With these precautions, there's no reason you can't enjoy your summer season. I'm Dr. Freddy Gomez, and thank you for joining us here on MedTalk Health Talk.